As we get older, what seemed like something we would never do suddenly becomes a possibility. This is largely true, at least, of cosmetic surgery. But do we need to go under the knife in order to look younger? Dr. Jon Mendelsohn has written a book called The Non-Surgical Facelift Book and is here to give us some less invasive options. Good morning to you.
Good morning.
You're local. You're from Hyde Park. You work in Hyde Park anyway, so this is in local bookstores?
It's in local bookstores and national bookstores, yes.
Okay, excellent. One thing I want to know, you are a plastic surgeon in Hyde Park, and you're telling us not to have plastic surgery.
Well, that's true. I am a surgeon, but we perform non-surgical and surgical procedures of the face and neck. Many of the non-surgical alternatives can do things that surgeries can't do, number one. Number two, there are many non-surgical options that for people who just don't have the downtime, who are looking for more of a quick fix, but very effective treatments these days.
Okay, let's start at the beginning. Botox. Do you want to say you have it?
Sure, I do have it.
I've never done this.
Uh-huh.
I'll admit to what I've done. The Botox, you have it done, and show us, because everyone worries that when you have Botox, like, you don't have any expression whatsoever.
Right, no, you do, and I don't know, as I raise my eyebrows, you'll be able to see the central area won't move too much, and I'm not sure where I'm looking here.
Just look straight ahead.
You can see it'll raise here, but it doesn't move much here. Same thing in the crow's feet area. That's an extremely popular procedure. 1.6 million Botox treatments were performed last year, and it is a fantastic procedure.
What should we expect to pay for something like that?
For Botox, a couple $100, usually $250 to $300.
And it's Botox. Let's get this right for everyone. Nothing is happening to you except they're injecting.
It's a protein. It's a protein derived from a bacteria. It's been used since the 1980s for many disorders: voice, eye disorders, back spasms, many, many things. Usually lasts anywhere from the first treatment maybe 3 to 4 months. Eventually it should last 6 to 8 months pretty routinely.
So you're not correcting your skin, but you are stopping the muscle movements that cause you to have wrinkles when you smile. And
that's correct. The dynamic or the active wrinkles. You got it.
All right, microdermabrasion. I have done that once.
Okay.
I enjoyed it. It was nice. I mean, your skin felt very soft afterwards. I would do it again, actually. But explain to people what that is.
Well, microdermabrasion involves using either crystals or some application of which helps exfoliate your skin. You could probably describe it better, actually.
It feels like they're like firing a little bit of sand on your face, and they work across, right?
There's some with crystals. That's obviously
crystals or sand.
But
that's what it feels like.
And then there are some with no crystals. But anyway.
Mostly feels like air, though.
Yeah, it's really a suction, and
they slough off the skin.
More or less, yes.
So can I talk over you again? Go ahead.
No, that's it. But I tell you, one of the new treatments that's very exciting is something called thermage, which uses radio waves. Have you heard of this? This uses radio waves to heat up the deeper portion of the skin, producing collagen, tightening of that collagen, and lifting. And I wish I had a photo here to show you, but it is absolutely impressive. No,
I don't think it's photos, but I did want to mention that in this book, tons of photos. Crew was looking through it earlier, going, "Oh my gosh, oh my gosh!" So and it goes through each of the treatments.
Yeah.
So if this is something that you're considering, it is a good handbook to have.
It's excellent. Yeah, the photos really do tell the story. And many patients come in and say, "Geez, if I would have known the treatment was that easy, I would have done it a long time ago." Type of.
So instead of thousands of dollars and weeks of recovery, we're talking about maybe hundreds to maybe $1,000.
Yeah, but yeah, generally these treatments, generally these treatments are $80 and up, and you walk out of the office and you look better.
All right, Dr. Jon Mendelsohn, thank you for joining us. Good luck with the book, The Non-Surgical Facelift.
Thank you, Tanya.